Hi everybody, it's Kate from Valere, and today I'm going to be taking you through some really helpful tips when it comes to patellofemoral pain syndrome, or commonly known as runner's knee. Now, patellofemoral pain syndrome is quite simply meaning patella is your kneecap, femur is your thigh bone through here. So that is pain around the anterior part of your knee. If you were getting pain more on the outside laterally here, it may be something more like iliotibial band syndrome. Generally, that patellofemoral pain is not also medially. Patellofemoral pain, or runner's knee, which is what I'm going to call it from now on, is generally exacerbated by movements that require repetitive knee flexion and knee loading. So that is movements, of course, such as running, jumping and landing, but more often than not, people with runner's knee will say that their pain is exacerbated by going up and down stairs, or prolonged sitting or prolonged driving can be another one as well. So let me take you through my really helpful tips. Have a look at your running gait and consider some particular running gait changes. Now, there are 3 different things that you can consider, and I'm going to go through the pros and cons of each of these. The first one is increasing a little forward trunk lean when you run. Research does show that potentially increasing that little forward lean from the trunk can change the way that loads go through the body and can decrease loads on your patellofemoral joint. However, when we do increase that, research also shows that this can decrease running economy. So this can make the load of running feel harder for you, and this may end up with different load distributions across other parts of your body that it may not be used to handling. So is the trade-off really worth it for looking after your knees? Maybe not. It could be something that you could try, but it's not necessarily my tip that I would give you to altering your gait. The second one can be changing to more of a forefoot striking pattern when you are running. This does show that it definitely does unload a little bit through the knee there, so it can definitely help with that patellofemoral pain or that runner's knee. But the really important thing to consider with this is that it does increase load through the calves and through the Achilles. So the last thing that you want to do is help unload your knee, but then end up with a form of calf niggle or Achilles tendinopathy. So there is definitely a trade-off there. If you do have the calf strength to handle that, then you may want to consider that. But again, it may not necessarily be the best choice when it comes to making changes in your gait. Which leaves us with option 3, which is an increase in cadence. Generally, when there's an increase in cadence, this can change the load distribution and can unload through the knee a little bit. Research also shows that when there's an increase in cadence, you can be more economical with your running. And this is a really good thing for your performance. So out of those 3 options, I would recommend aiming to increase your cadence first to be the best way to unload through your knee there. And this can start off even with an increase of 1 step per minute if you want to start with that for your next run, and then try and play around a little bit from there. Generally, research does support approximately an increase in 10% in your steps per minute, particularly if you're on the lower end of around that 165 steps per minute. Definitely worth considering increasing your cadence. This one is very, very important, and it comes to including some form of strengthening through your lower limbs to help your body be able to tolerate the loads of running and decrease your symptoms. When it comes to runner's knee, there is a big question against, do I strengthen up through the quadriceps, which are the muscles along the front here, and they are very important when it comes to looking after runner's knee, or is it more important to strengthen up through the glutes? The answer is strengthen both. In fact, there is even a little bit of research that shows that freely chosen exercises can be as beneficial as a structured program. That is if it is complemented really nicely with managing training load and including some of those exercises that strengthen up through the glutes and the quads. So the big key take home is really just to work on any of those muscles that strengthen up through your lower limbs. So I'm going to take you through some really helpful ones. The first that we're going to start with are going to be some quadricep loading exercises. I'm going to take you through 3, and they're going to start from being easiest. So this is if your runner's knee is particularly flared up, these should be your non-aggressive ones, and then I'll progress the complexity as we go, as your runner's knee gets better over time. Okay, so exercise number 1 is a wall squat. Now, keep in mind what I said before about knee flexion or the knees bent being one of the exacerbating activities for runner's knee. You want to make sure that when you do your wall squat, your knees are bent to an angle that is not going to flare up your symptoms. And that's very important, and you can progress this over time. So I would start off with more of a quarter range squat, standing against the wall and loading up through our quadriceps in a nice isometric way. So what that means is the quadriceps are being loaded, but they're not lengthening and they're not shortening. And that's a really nice way to put in load while strengthening them up without flaring anything up. So with these ones, coming into your wall squat, holding, and I would start off and hold this for 4 lots of 30 seconds. So I do a 30-second hold with a 30-second rest. Your next progression from here, because you do want to strengthen up your knees eventually through that range, is to bring yourself down a little bit more. So as you can, bring yourself down so that your quadriceps or your thighs are parallel with the ground. And I would hold for the same duration here. If that is feeling really good, you can, of course, progress, and you can grab a weight plate and you can add some load there and hold on to make that even harder. But this is a great isometric loading exercise through your quadriceps to strengthen them up. So as I touched on before, it's important not only to strengthen up through the quadriceps, but also through your glutes, particularly through your glute med. And that's because your glutes play an important role at minimizing that pelvic hip drop and from letting that knee fall in towards the midline and creating abnormal forces through the knee, particularly in the single leg stance of running. So here's a couple of great exercises that you can do to strengthen up through your glute meds. This first one, we are going to do a hip abduction off a step. And I like this because you not only work on the hip abductors of this side, so through the glute med through here, but also on the standing leg and a little bit of quad loading at the same time. So with this one, it's a slight bend through the hip and a slight bend through the knee on that standing leg. Keep an eye on that standing leg and don't let the knee fall in. Keep it nice and straight. And from here, you're going to come out into hip abduction with this leg. So from here, keeping that nice and straight, powerful out into the abduction and in, out and in, out and in. Whilst you're thinking about working those hip abductors, this band is going to want to pull this leg in. So fight against that. Use your hip abductors on this side as well. So it's a really nice all-round one. Plus you get a little bit of core strengthening too. With this one, work a little bit more on muscular endurance. So see if you can aim for 3 sets of 12 repetitions on each side with 60 seconds of rest in between. With this, because you can do it at home, I would recommend doing it 4 to 5 times a week. The last exercise that I like to do to target particularly through the quadriceps is a split squat. With these ones, they are great for targeting the quads, but they also do work through the glutes, the hamstrings, the hip abductors, and the hip adductors, making them a great choice for runners. So with these ones, I am doing them in a Smith machine, and that's because the Smith machine keeps the barbell going straight up and down. So it removes a little bit of that technique that you have to focus on. So then you can load them up nice and heavy to build the pure maximal strength of your quads and the other muscles. So with these ones in that Smith machine, you're going to unrack, take 1 step forwards with your front foot, 1 back with the back one, shimmy it back quite far, and then bending through that back knee. 1, 2, 3 second down, power and control up. 1, 2, 3 second down, power and control up. With these, you are bringing your knee into knee flexion, which at the start of when you had runner's knee would have been your aggravating activity. But because these are more of an end stage one, it's okay to go in that range as long as it's pain-free for you. If you are still getting pain at some stage of these, just shorten the range of your split squats, but make sure that you are keeping that nice 3 second control down and that powerful drive up. That 3 second control down is important because that builds that eccentric strength, and that can be really, really helpful for people with runner's knee. With these, I would load them up quite heavy, again, because it's an end stage exercise. So I would start with 4 sets of 5 repetitions at a weight that leaves you with 3 reps in reserve. And because it is heavy and there is still a little bit of technique to focus on, I would give yourself 2.5 minutes of rest in between each of those sets. You can load that up as you feel like you can, obviously, and as you can tolerate over time. If you keep doing your gym training, which you should, and if you are more susceptible to runner's knee, make sure that you include these as an injury prevention exercise as well, because it really does load up those knees in that more aggravating movement of that knee flexion. So you want to get your knees used to that movement. Manage your training load. Now, good news, that doesn't necessarily mean that you have to cut out your running, okay? If your pain is a 2 to a 3 out of 10, odds are you could probably keep running, especially if you know that your diagnosis is runner's knee. But you may want to manage that training load. Runner's knee does generally flare up from a sudden increase in training load or an increase over time as well. So it is definitely a little bit more of a chronic condition, meaning that it doesn't just suddenly flare up, but it will be the result of overtraining generally. So if you can cut back your training by anywhere between 10 to 30%, and this is going to be completely athlete dependent, so it really does depend on you, but making those small alterations can help unload that knee a little bit and decrease your symptoms. Like I said, if your pain is a 2 or 3 out of 10, generally you can keep running through this. You actually don't want to stop running, okay? If you do stop running, odds are when you go back to training, you're going to flare up somewhere else and then end up with another injury. You can decrease this load by either decreasing your total running kilometers, so decreasing those by that 10, 20 or 30%, or you can dial back the intensity. Again, completely athlete dependent, and you will know what flares up your symptoms and what may help it as well. You can also replace some of that training with some other forms of non-impact and non-repetitive knee flexion loading, such as swimming. Cycling may also increase patellofemoral pain or runner's knee, so that may not necessarily be the best substitute, but anything that doesn't flare up your symptoms, you can use that to replace that part of your training. And this is also, remember, only temporary, so the goal is to build back up again. You may or may not want to consider foot orthoses. There is some research that does show that this can actually help with runner's knee, but this is very, very athlete dependent. So this may be something that you may want to have a play around with, but also if you manage your training load and take into consideration these other tips, it may not be something that you have to do. So your take-home key tips to help you manage your runner's knee are: number 1, look at your training load. Perhaps consider dropping that 10, 20 or 30% depending on your symptoms. Number 2, consider orthoses, but I would leave that to last to make sure that you cover these other tips first. Number 3, consider gait changes. Out of the 3 that I did suggest, I would suggest increasing your cadence first, because that can help distribute loads differently and potentially unload your knees. And number 4, include your strengthening. Number 4 is not the least important. I didn't leave it to last because it's the least important. It's very important, and definitely consider including that. When including your strength programs, remember to work on quadriceps strengthening, glute strengthening, and also other lower limb strengthening. When it comes to considering these tips, please keep in mind that this does not replace medical advice. If you are struggling with any knee pain and you want to make sure that you're getting the optimal care, please make sure that you ensure you get some healthcare professional help. If you have any questions about how to help manage your patellofemoral knee pain or runner's knee, pop them in the comments below.